Hello everyone and welcome to the case 32 of this case discussion series, and today we'll be discussing a case of spinal injury. So here we have a 51-year-old male who came with history of fall from height, and these are the T2 weighted images, sagittal section, where we can see that there is fracture, reduced height and fracture of L1 vertebra with retropulsion of the fracture fragment causing canal stenosis and cord compression. Also there is disruption of the posterior ligamentous complex. Normal T2 hypointensity is lost at this level. Now on these sagittal stir images also we can see some marrow edema in L1 vertebra as well as on D12 vertebra, along with disruption of the posterior ligamentous complex. These are the axial images where again we can see that there is fracture of the vertebra along with the involvement of the spinous process of the vertebra. This is the fracture of the spinous process that is very well seen. This is a report I had given. Reduced height with wedge compression fracture and extensive marrow edema on stir sequences in L1 vertebra, along with retropulsion of the posterior superior fracture fragment causing canal stenosis and cord compression. This itself is the definition of a burst fracture. Then along with that there was linear T2 hypointensity seen within the conus medullaris, suggestive of cord edema at L1 level. There was fracture of the spinous process along with disruption of the posterior ligamentous complex with edema. Features were suggestive of burst fracture of L1 vertebra with Tillich's score of 9. There was mild marrow edema seen within D12 vertebra as well. So here the learning point is Tillich's score, that is thoracolumbar injury classification score, which I have already discussed in detail in a video. Here we have three independent predictors: morphology of the fracture, integrity of the PLC, that is posterior ligamentous complex, and the neurological status, which is assessed on physical examination clinically, which predicts the need for surgery. So here the morphology of the injury was a burst fracture, that is defined as compression fracture of the vertebra along with retropulsion of the posterior superior fracture fragment. Integrity of the posterior ligamentous complex, which constitutes the supraspinous, interspinous ligamentum flavum and the facet joint capsule. Here it was injured. So here the score of 2 plus score of 3. Neurological status, the patient was having very reduced power on the bilateral lower limbs, suggesting an incomplete cord injury. Again adding a score of 3 to it, so total score of 9. The patient needs surgery according to Tillich's score.